I'm going to talk about the pathophysiology of atrial fibrillation. So what atrial fibrillation is that there's a focal point that isn't the SA node, but it is coming from the atrium, and that then triggers the ventricles to contract. So the focal point is multiple different places within the atria, and they're all firing at the same time, all different times as well, just completely random. So what this actually does is it makes the atrium quiver instead of beat faster, or beat normally, sorry. So we say that this is actually reducing the atrial kick. So normally the atrium will fill and then it will squeeze and pump that blood into the ventricles. This isn't happening in atrial fibrillation, it's just quivering. So in response to this, the AV node tries to help this from becoming a big problem, and it will only let a few of those signals through into the ventricle. So it will block most of these. But what this does, it actually will increase our ventricular rate sometimes because of how many times the AV node will let a signal pass through. So long term, you can see that this will cause some problems as well, and if we are at a stage of uncontrolled VF, which is anything above 100 beats per minute ventricular rate, we'll get immediate problems as well. So if we're in a state of uncontrolled VF, that means we have a loss of atrial kick plus the increased ventricular rate. This is going to decrease that filling time in the ventricles before they can even squeeze enough out, which is going to decrease that cardiac output. And when we have a decrease in cardiac output, we see physical symptoms, and a really common one is syncope, so the patient will faint. They'll feel a little lightheaded, dizzy, they might have palpitations, might be sweaty, all those types of things as well. So that's in uncontrolled AF. So long-term effects, we're going to see problems with clots and stuff, because if it's quivering, that blood is going to be not moving around properly, and it's going to have stasis. So when we have stasis of blood, we have clots forming. And when that forms, if they pass through here in the ventricles and then go into the body system, we can have strokes, PEs, and blood clots through emboli. Okay, so this is atrial fibrillation, what we would expect to see using our 5-step method. So first of all, the regularity is really important because it's always going to be irregular. It's never going to be a regular rhythm. We won't actually be able to measure the atrial rate because it won't be like atrial flutter, which we can measure atrial fibrillation. It's just not a pattern we can measure at all. So the rate, because of that, we can't measure atrial rate, but we can measure the ventricular rate. Now this will vary depending on how fast it is. We call it different things. So for example, anything over 100 beats per minute is called uncontrolled atrial fibrillation. Anything between 60 to 100 is controlled atrial fibrillation, and anything under 60 beats, we say that it's atrial fibrillation with a slow ventricular rate. Now the P waves, there won't be any P waves. We call these fibrillatory waves. So we can't actually measure a PR interval. The QRS will be normal. It will be less than 0.12 seconds. I put this rhythm here. So the first thing we do is look at regularity. So we can already see that there's a big difference between the R to R intervals. So this is going to be irregular. So is it regularly irregular or not? So to do that, we see if we can find a pattern, and there isn't really a distinguishable pattern here. So we're going to say that this rhythm here is irregularly irregular. So the next thing we're going to do is find the rate. So because it's an irregular rhythm, the only method we have is the 6-second method. So we can see here, this ECG gives us the indicators for 3 seconds. So to find 6 seconds, this will be 0, 3, 6 seconds. So from here to here, 6 seconds, we just count how many R waves we have. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 times 10 is 90, so we can say this has a rhythm of 90 beats per minute. P waves. So we have these really weird waves here. They are not P waves, these are fibrillatory waves. So because of this, there's no PR interval. If we look at the QRS complex, we can see that they are narrow, not wide, so they're less than 0.12 seconds. So because of this, we have our indicators for atrial fibrillation. So this is because it is an irregular rhythm. We have our fibrillatory waves. So all we need to do is classify what type of AF it is. So because it's 90 beats, this is going to be controlled AF. So we say controlled atrial fibrillation at a rate of 90 beats per minute. I'm going to go through this ECG strip because a lot of people tend to have trouble with it. So let's just start off. So first of all, regularity. So these look pretty regular. So we're going to say this is a regular rhythm. Rate, let's just do our 300 method. So 300, 150, 175. Let's just say about 75 to 80 beats per minute. P waves. So we can't really tell if there's a P wave here. However, if we look closely, these tend to have a pattern that looks like there might be P waves hidden underneath and T waves as well. So we can't say that there are distinguishable P waves, so we just have to say they're probably normal, however they're difficult to determine, and the same for the PR interval because we can't actually see the beginning of the P wave or not. The QRS complex is normal, less than 0.12 seconds. So the interpretation. A lot of people say that this is atrial fibrillation because we think that these are fibrillatory waves. However, we can rule out AF straight away because this is a regular rhythm. Atrial fibrillation will always be irregularly irregular. So that's a quick little guide to ruling that out. So we just say this is actually a normal sinus rhythm with electrical artifact. So this here is artifact rhythm. So we can't actually interpret much further, but we know that it is a sinus rhythm because of these little hidden P waves here.